Hearing loss affects people of all ages and can be caused by many different factors. The three basic categories of hearing loss are sensorineural hearing loss, conductive hearing loss, and mixed hearing loss. Sensorineural hearing loss is a type of hearing loss in which the root cause lies in the inner ear, sensory organ, cochlea and associated structures, or the vestibulocochlear nerve, cranial nerve 8. Sensorineural hearing loss accounts for about 90% of reported hearing loss. Sensorineural hearing loss often occurs as a consequence of damaged or deficient cochlear hair cells. Hair cells may be abnormal at birth or damaged during the lifetime of an individual. There are both external causes of damage, including infection and ototoxic drugs, as well as intrinsic causes, including genetic mutations. A common cause or exacerbating factor in sensorineural hearing loss is prolonged exposure to environmental noise, or noise-induced hearing loss. Sensorineural hearing loss may be accompanied by other symptoms such as ringing in the ears, tinnitus, and dizziness or lightheadedness, vertigo. The most common kind of sensorineural hearing loss is age-induced, presbycusis, followed by noise-induced hearing loss. Conductive hearing loss occurs in the outer or middle ear, where sound waves are not able to carry all the way through to the inner ear. Sound may be blocked by earwax or a foreign object located in the ear canal. The middle ear space may be impacted with fluid, infection, or a bone abnormality, or the eardrum may have been injured. A 45-year-old woman visits her primary care physician because she noticed a sudden loss of hearing in her right ear. She says it started just a few days ago, but she does not recall any trauma or inciting event. She does not take any medications but says she was hospitalized 1 month ago for a serious urinary tract infection requiring some powerful antibiotics. On further questioning, she also notes an increased sensation of ringing in her right ear. Otologic examination reveals a translucent, pink-gray tympanic membrane on the right. When a vibrating tuning fork is placed at the center of the patient's forehead, she hears the sound better in the left ear. She also hears the tuning fork better on both sides when it is outside the ear compared to when it is placed on the mastoid process. What is the most likely diagnosis? This patient has sensorineural hearing loss. The recent hospital course suggests antibiotics, most commonly aminoglycosides, as the likely culprit. Sensorineural hearing loss is often associated with tinnitus. The otologic examination reveals a normal external ear canal and visualizes a normal tympanic membrane on the affected side. Weber testing lateralizes to the opposite ear, whereas Rinne testing in the affected ear is normal. What is the mechanism underlying the findings on Weber and Rinne testing? In sensorineural hearing loss, the cochlea or cranial nerve 8 is damaged. This means that the sound signal does not transmit appropriately into the central nervous system. The result is hearing loss on the affected side. Weber testing is conducted by placing a vibrating tuning fork in the center of the patient's forehead and asking whether the volume is different between the two ears. In sensorineural hearing loss, Weber testing lateralizes to the opposite side because of normal sound signal to central nervous system transmission contralaterally. Rinne testing compares air conduction with mastoid bone conduction of sound. The vibrating tuning fork is placed just outside the external ear canal and then on the mastoid bone, and the patient is asked to identify which location produces a louder perception of sound. There is no obstruction of air conduction in sensorineural hearing loss, so Rinne test results in a louder perception of sound through air conduction, as is the case in normal hearing function. What is the primary differential diagnosis of this patient's hearing loss? Hearing loss can also be conductive in nature. This occurs when there is an obstruction of the ear canal, so rumen impaction, or mechanical dysfunction of the middle ear apparatus due to an inflammatory process such as otitis media or otitis externa that helps transmit sound waves to the cochlea. What would the Weber and Rinne tests find in conductive hearing loss? In conductive hearing loss, the Weber test lateralizes to the affected ear. This is due to the reverberation and accentuation of sound caused by entrapment of sound waves behind the occlusion or site of dysfunction. The Rinne test results in greater bone conduction of sound in the affected ear because air conduction is obstructed,